Hi, welcome to Case of the Day, and today is the 71st case of the Sunburst appearance. I had a lot of fun doing this and going back to some old concepts that I had kind of partly forgotten. So, this 21-year-old presented with a lesion in the right proximal humerus, and this case came to me today for an opinion from the pathologist. And you can clearly see here that there is an osteolytic lesion in the proximal humerus, epimetadiaphysis, there's osteoid or new bone formation, there's a sunburst periosteal reaction, and there's osteoid along these spicules. You can see them here as well. There is abnormal soft tissue, a permeative appearance, wide zone of transition. So, obviously, this appearance the sunburst and the permeative appearance suggest an aggressive lesion. There's osteoid, so new bone formation. So, an aggressive permeative lesion producing osteoid would definitely, therefore, be an osteosarcoma. And a sunburst appearance is one of those hallmarks and while of osteosarcoma, and while it can occur with other tumors, it is commonly associated with this entity. Now, when the tumor grows rapidly and invades the surrounding periosteum and it's lifted off the bone, there is new bone laid down in an unorganized fashion. So you have these tumor spicules that grow perpendicularly into from the cortex into the soft tissue, following the path of Sharpie's fibers. And so that's how you see these mineralized spicules, which appear as linear opacities extending outwards, resembling a sunburst appearance. So that's the sunburst that we see here. There is this article in 23 on periosteal conditions that has this diagram of Sharpie's fibers connecting the periosteum to the bone. Um, and this is a schematic from ChatGPT where it shows how you can have tumor cells growing along Sharpie's fibers, especially when the periosteum is lifted here. And that would give rise to the sunburst appearance, which can also be seen with Ewing sarcoma, metastatic disease, and other tumors. It was so unusual for this patient that you have in Jan there is a radiograph showing an intraosseous lesion. There's a little bit of periosteal reaction medially. And then in April, the sunburst appearance has already started, and then it's progressed significantly in June. I'm not quite sure what happened during this time because I don't have all the history. But this is, in a way, a bit of a tragedy, isn't it? Because things would have been so much easier to handle in Jan as compared to now. There is a recent PET CT that shows these perpendicular spiculated lesions along Sharpie's fibers, the CT correlate of the sunburst, and that's the PET. And the MR shows the same things. You get these perpendicular areas, that's the T2 coronal, that's the T1 coronal, and that's been described in literature as well, starting almost in, I think the first paper was out somewhere in the 90s in pediatric radiology. And so you get this sunburst appearance on X-rays, on CT, on MR, but obviously classically it is on X-rays. There is a new paper that came out in skeletal radiology that again reassesses the usefulness of radiographs, and there it's given the schematic of differentiating the benign periosteal reaction from the aggressive and the malignant ones. And here's the sunburst. The hair on end's a little different because that just goes straight parallel, more common with Ewing sarcoma, and then Codman's triangle or Codman triangle occurs along with the sunburst appearance. And you can see that here. This was a case that I put up at BST Neoplasms. It's all easily available, and there's a video describing this entire telangiectatic osteosarcoma, but you can see the sunburst here beautifully and the Codman triangle. But I will do another post one day sometime in the future on Codman triangle. So the sunburst appearance suggests an aggressive neoplasm. Is commonly seen with osteosarcoma, though it can be seen with other tumors. Not very commonly seen these days because tumors are often picked up much earlier, but when you see it, it's reasonably classic. That's the classroom that I'm starting in about a month's time. That's the WhatsApp channel. Thank you so much for viewing this.